the CBO, the Congressional Budget Office, looked at the plan that passed the House, although there were some changes to it, and said 14 million people who are on Medicaid will no longer be able to be on Medicaid. Governors from around the country, including these 7 Republicans I'm about to put on the screen, they're on the record saying they're concerned about these cuts to Medicaid in this health care bill. If you believe in sending this back to the states, shouldn't you and President Trump be listening to these Republican governors who are on the front lines?
Oh, in fact, we have listened, and we've listened very intently and had wonderful meetings with Republican governors. Remember that there are no cuts to the Medicaid program. There are increases in spending. But what we're doing is apportioning it in a way that allows the states greater flexibility to cover their Medicaid and care for their Medicaid population. This is incredibly important. And I know that you know, the media loves to talk about the cuts that the CBO talks about. But again, what the Congressional Budget Office measures is spending as if nothing changes at all, as if the program is doing just fine. Thank you very much. The fact of the matter is that the program isn't doing just fine. And so what the president's commitment is, what our commitment is at Health and Human Services, is to make certain that those individuals in the Medicaid population get not just the coverage that they need, but the care that they need. And that's what's important.
Are you actually saying that $880 billion in cuts, according to the CBO, however you want to talk about that not being a cut, that that's actually not going to result in millions of Americans not getting Medicaid?
Absolutely not. And we believe strongly that the Medicaid population that will be cared for in a better way under our program, because it'll be more responsive to them. These decisions will be made closer to them. Right now, you've got Washington, D.C. dictating to the states and dictating to patients exactly what must occur. That's not how a healthy health system works. A healthy health system works by allowing those individuals closest to the patients themselves to be making those decisions. And from the president's perspective and our perspective, that means patients and families and doctors making medical decisions, not Washington, D.C.